Welcome to More Than Miles. Whether you're on a run, driving, doing laundry, or cleaning your house, thanks for taking us along. On this podcast, we believe that our athletes are so much more than their body and sport. So we dive deep with conversations and expert interviews to widen the lens on what it means to be a happy and healthy endurance athlete. I'm Dr. Kate Mihevik-Edwards, physical therapist, author, educator, and former endurance athlete. Through 12 plus years of successfully treating thousands of frustrated athletes and navigating my own health struggles, I've learned so much, and I really can't wait to share it with you.
And I'm Dr. Kacy Sinders. I'm a physical therapist, runner, and advocate for mental health and endurance sports. As an athlete myself, I understand the endurance athlete lifestyle and the impact that injury can have on our daily rhythm. I'm also known for my T-Rex costume and Wiggle Wednesday series on Instagram. Our goal is to always keep our athletes healthy on and off the road. As a wise woman named Pink once said, let's get this party started. So I really want to set the scene for our listeners today, because when we do these episodes together, I want them to feel like they're just hanging out with us. It could be, on the street, in a bar. I don't care. I want them to feel like they're hanging out with us because I feel like we're really cool people. So first, we are in my treatment room today because it is raining here in Atlanta and our roof in our clinic is very loud. So we almost had a disaster and couldn't record today. So we're in my treatment room because it happens to be soundproof.
Because she's so loud.
It's true. It's true. Once we moved over to switch locations, both Kate and Ryan were very happy that I had a soundproof room so they didn't have to hear me talk and laugh and all my bad dad jokes anymore.
I like your laughing, though.
Oh, well, thank you. I like your laughing, too.
And you're funny, haha, so those jokes are okay.
Funny, haha, my official term to describe my sense of humor. So we're really excited to talk about dead butt syndrome today. And I can hardly say this with a straight face because I know that we're going to try to go through the gamut of names there are for the butt.
The booty.
The derriere.
The tush.
I feel like I want to go on, but that's going to get obnoxious.
Okay, but can I at least say hiney?
Oh, yeah. Hiney is your favorite, isn't it?
Hiney is my favorite.
Hiney.
And it really stinks when my... hiney stinks. Oh, totally not appropriate. Okay.
Anyway. I think it was very appropriate.
I was going to say, I always call people's butts their hiney when they're on my treatment table because I was 7-year-old. And I'm like, turn over on your hiney. Such a mom.
You are such a mom.
Let's get down to this because you don't need to hear us talk about butt names all day.
So this dead butt syndrome, just the phrase itself just really bothers me. And so first of all, right off the bat, calling any part of your body dead, I think is very rude to your body. I'm all about body positivity here. But it's just this, it becomes this thing in the media, which I know sounds kind of funny to say from like a physical therapy perspective, but there's like articles about it. There are plenty of things you can find in Google on their internet about dead butt syndrome, what to do if you have it. And I feel like it's so surface level. So I'm really excited that we're going to dive a little bit deeper into debunking some of the myths that are out there and hopefully getting people a little bit better grasp on what to do so that you actually have strong glutes that work when you're running and prevent injury like everyone says that it will.
That's right. And there really are a lot of articles. I Googled it just to make sure that I didn't think there were a lot of articles and there weren't. All the articles talk about how sitting on your butt all day and being inactive creates dead butt syndrome. And there's things out there that say, oh, sitting on your butt is the compression of the tissues. There's no blood flow going to the butt. And yes, we totally agree that you should not sit on your butt all day long. And if you're a runner or an endurance athlete, sitting on your butt all day long to work still means you're sitting on your butt. It doesn't matter if you're going out for 20-mile runs or, bike rides, swimming, whatever. So movement during the day is absolutely important. But that's not the issue here. Most of the time, it's not that you have dead glutes or dead muscles or muscles don't work. It's that they just need a little encouragement. And it's also not just the butt that should be blamed. We can't just blame the butt.
We have a note on our on our dashboard, as we're going through these topics, and it says it's not just the butt.
I did write that. I totally wrote that.
And it's not really. So we're talking about glute activation specifically, or the glutes' ability to do their job correctly, right? And so this is going to be influenced not only by your neuromuscular control of your glutes, but also the posture that you're in when you're trying to use your glutes. So this comes down to running posture, which I know is something that we work on with everybody who comes through our clinic. And I think you feel very strongly that we can't treat anyone really without addressing the spine. So I'm going to let you get on your spine soapbox, and I'm just going to sit and enjoy.
No. It's true. I think that if you avoid the spine or don't look at the spine, you're absolutely missing the boat. And one of the things we learn in school is you have to treat above and below the injury. Well, I think it's much bigger than that. You have to treat the entire kinetic chain in order to address the issue. So if you have something going on where you can't feel your glutes working, it doesn't mean they're not working. It means that maybe you just don't know what they feel like, or perhaps something's going on higher in your lumbar spine. And so we know that if you look at anatomy, which everything's not just about anatomy, but if you look at anatomy, you know that L4, 5, S1, and maybe part of S2 sometimes contributes to innervating the muscles. So basically those nerves or those segments of the nerves tell the muscle what to do. And so if we don't address that in some way, shape, or form, I think we're not doing everything that we need to be doing. My soapbox is not that high today, apparently.
No, that was good. But I think to bring this down a level, or maybe just to simplify it a little bit, the way I talk about this is, so we want our muscles to be in an optimal position to function.
Length tension
relationship, right? So there's a few things that practically that we do in PT school to demonstrate this concept. None of them work with an audio format.
What, you can't see us doing?
You can't see us doing things. Yes. I was going to come up with a great example, and then I realized no one can see me. So I think the most common pattern, now this isn't the only pattern, but I think the most common pattern we see is anterior pelvic tilt, increased lumbar lordosis, and this is going to change the relative attachments of our glute muscles.
Mm-hmm. So make sure that we know anterior pelvic tilt is where your pelvis is actually tilted forward. Lumbar lordosis is a bigger curve in your lower lumbar spine.
That's right. So if you were to put your hands on your hips would be tilted forward, That's essentially. Right. And so even if I don't know where you are right now, but if you stand up and tilt your hips forward, you should see that your back is going to extend some, or as Kate said, you will see an increased curve there. And so the problem with this is this affects the nervous system and the nerve's ability to travel to the glutes, tell them what to do, and it's going to affect how we use that entire part of our body, which is a lot, right? So if we think about lumbar spine and pelvis, that's pretty much the core of our body, right? Like
it is the core.
It is the core, actually. For real, if you look it up. So when we're in that, like I said, anterior pelvic tilt, so the front of our hips are tight, and it's going to put the glutes in a position where they're not going to work quite as well.
That's right. And then other things that impact the glutes are, like you said, tightness of the hip flexors, so the anterior hip, the front of the hip. Using your quadriceps, overusing quadriceps, so like that front part of the body, we call, that makes it harder for you to kick on your glutes. We look at it like anterior chain is the front of the body, posterior chain is the back of the body, and most runners and endurance athletes are really, really good at working that anterior part of the chain, but they're not so good at getting that posterior part working. So it's not just the glutes, it's also the hamstrings and the lumbar multif, or the lower small muscles in the lumbar spine that aren't really doing what we want them to do. And so we have to look at it like that and say, okay, how can we make it so that these muscles are firing and you can get the best out of them? And it's not just a clamshell. It's not just a bridge. Those are, okay, I'm going to do it. I wrote in my notes, trash the clam.
We're here to trash the clam.
We're not trashing the clam. I mean, so it has a place, right? The exercise has a place, but it's really not a great exercise because it's not functional. We want to do things that are functional for the glutes. We really want to work them in a way that they work every day while you're moving.
Exactly, yeah. And I mean, we talked before, there are certain cases where we've had to pull the clamshell out of our back pocket to achieve a certain goal, right? But for most of our runners, our goals are standing, weight bearing, and not on a table. And I can't tell you how many times I've seen patients and I ask them what they do from a strengthening perspective for their hips, And they're all exercises where they're laying down. And
that's a huge problem.
It's a huge problem. And, sometimes this is necessary in the beginning of the rehab process just for the athlete or the patient to feel what that feels like to work, get a good muscle burn, understand what that feels like to be using the appropriate muscles. But we need to quickly transition that to standing, because if we don't progress from table to standing, we're never going to be able to actually access that pattern while running. And that's our goal, right?
Yep, that's exactly right. And I like how you said we will have to do some things in the beginning on the table. If you don't really know what we're talking about, or if somebody doesn't know how to really move a certain way, or their body awareness might not be as good as somebody else's, or they're having pain, we may have to show them things to do on the table. But the goal is get them up, get them functional, get them moving. And like going back a little bit, we were talking about one of the major patterns that runners and triathletes or endurance athletes have is really loading the quadriceps, really being forward in their body, getting tight hip flexors, and having that weak posterior chain. So if we can teach our athletes how to tap into that posterior chain in a functional way, that can really benefit them a lot.
Yeah, and this isn't only injury prevention, right? This is from a performance perspective too. So if we look at the quadriceps as a muscle versus the glutes as a muscle, so the quadriceps has a lot more fast twitch muscle fibers, where the glutes have a lot more slow twitch muscle fibers. Mm-hmm. So they have an improved capacity for endurance. So if you think about if you're using all your quads, they'll get tired out mile, 13, 14, 15 of your marathon, versus if you're using your glutes, you're going to be a little bit more efficient. Hopefully you don't fatigue out as quickly, and you can actually generate more power overall.
We didn't even mention what the glutes did, which is really interesting, because you would think if we're going to talk about the butt the whole time, we should probably say what they do, right? So there are three major muscles that we can call the glutes. And so we have gluteus maximus, gluteus medius, and gluteus minimus. And their primary job is stability of the pelvis. And what we know is that gluteus medius is the one that always gets blamed for everything. It's like
hip drop.
That's right. Oh no, Trendelenburg gait. That person's strutting. Do you see them strutting? Their hips are dropping.
Those hips are weak. But some glute exercise is stat.
I think that person has a dead butt. So we're in rare form today, you guys. I don't know if it's because we're talking about the butt or if it's raining or I don't know what, but it's been quite the morning.
It really has. And we're already out of coffee.
I know. And we just started.
I know, but we can do this. We can totally do it.
We can totally do it. So the glutes, they're really important for stability, but they worked with other muscles. So the thing I'd like to say too is that the gluteus medius needs to be strong. Yes, absolutely. It's a muscle that you don't really get stronger by moving forward in a forward direction, which is what running is. You need to have more lateral or sideways movement to get it actually moving and firing, and some rotation too. So there's a lot of exercises that do that, but you also need to have your adductors firing. So like your inner thigh, if you're going to be running or moving, running is a single leg squat over and over and over again, right? And single leg squat is the one thing that every doctor, every physical therapist does to see if someone's glutes are firing. And every time I see it, they're like, oh man, your hip's dropping, you have valgus, you look like crap.
Sounds about right. And so the other thing I think is important is the performing of these exercises correctly. So I will often teach people what it feels like to do them wrong, or what muscles I don't want them to feel. For example, one very common pattern I see is like unilateral or one-sided back pain. So if we think about our QL, which is the really big flank muscle we have on our back, also plays a really big role in pelvic stability. And so if our glute med isn't doing its job, then the QL is going to be like, hey, I'm going to help, which is great for a little bit, but can also cause back pain. So teaching...
We're back to the back.
We're back to the back, always. So teaching people, what that feels like really and what postures we're looking for, whether they're on the table or standing, to not use their QL, not use their TFL, right, in the front of the leg, because that's another muscle that can get tight, want to kick in and help, and it's not going to provide that same level of pelvic stability that a powerful, strong woman, no, powerful, strong glute med can bring.
I loved it. I like how you slid that in there. That was really good.
Yeah. Thank you.
You're welcome. When I look at single leg squat, I look at what happens at the foot. I look at to see, okay, is that foot going into pronation, supination? Does it have enough dorsiflexion? So that means, is it bending enough? Is it rolling in too much? Is it rolling out too much? Then what happens at the actual tibia? What happens at the tib-fib joint? What happens at the knee? Is the knee coming in? Is it rotating in? Is it going too far forward? And then I'm looking up at the hip. Is the hip dropping? Is the back bending? Are you grabbing? Are you using your QL too much? So single leg squat actually captures so many things. And it's not just the glutes. I just want to keep saying, it's not just the glutes. I want to yell it from the rooftop. Glutes are really important. They do a great job, but they're important for pelvic stability. But it's not just the glutes. It's also being able to breathe. It's being able to get your core kicked on appropriately. It's about being able to stabilize from all the way from the foot to the top of the body.
Yeah, so the foot and hip need to work together. And this is something I find myself saying all the time. And I've been using our Mobo board a lot, actually, with this to demonstrate it. So if I put a patient on there, so if you're not familiar, the Mobo board is a balance board. It was developed by Jay Duchari out in Oregon. I think he researched at University of Virginia for the majority of his researching career. But it has a cutout for just the big toe. So you are supporting yourself on the big toe, and the rest of your toes are kind of fall through this little cutout in the board. So essentially what it does is it really forces you to use your big toe, and along with that, it's going to activate all your foot intrinsics, and it's going to really fire up in that foot. Sometimes I'll let people just stand on it and see what happens. And it's a really good diagnostic tool for me because I'll ask them what's getting tired. And usually they'll tell me their foot and their calf. And so that gives me like, hey, so that's what's happening every step. That's why you have arch pain. That's why you have calf pain. You're having to stabilize so much with your foot, and you're not able to bring your hip in to help your foot with stability.
Yeah, I think it's great. I love that. And I use it a lot myself. And I like to do, it's actually really fun to get on there and then start adding things like a kettlebell or whatever it is. But it's very hard just standing there. If you've never stood on it, it's really, really hard.
Yeah, it's very hard. I've been practicing quite a bit now, but when I first stood on it and I was like, well, let me add a little single leg squat in here. Like knee valgus, it was terrible. I was disgusted. I got off and I had to regroup for a second. It was disgusting.
I thought you weren't supposed to talk about yourself that way.
I'm not. But the thing is, I recognize that this could be changed. I could practice and get better. And you know what? Now they look pretty good.
Yeah, you do look pretty good. Actually, we had I taught a course. Oh, it was this week, wasn't it?
It was this week.
Yeah, I taught a course called The Running Athlete. I'm sure you're all shocked. I had Kacy be my model for all of these photos and videos for the treatment part. And I was really impressed. I have to say, I'm saying it on a podcast because I was so impressed at how strong you've gotten and because you've been practicing.
Yes, thank you. I mean, it's all been for you, Kate, so that we could take these videos. It has nothing to do with me wanting to run better, healthier. I just really want to be a perfect example for your future students.
Hey, thanks. I really appreciate it.
Yeah, no problem.
No, it's keeping you healthy. I mean, let's talk about that for a second. I mean, I just turned it a little bit, but
sure.
How much better do you feel now that you're stronger? I mean, you really have been working hard this year on strength, glute strength, foot strength, core strength, all of it. I mean, I see you all the time in here working.
They joke that I live here because I'm here all the time, but I feel great. I mean, I'm closing out a 50-mile week this week, and I do not feel beat up at all. And, about a year ago, I think I ran my first 50-mile week in a long time, and I was like, oof, I really feel it. Like I, felt tired. I felt kind of achy, could kind of feel it in my joints a little bit. So I feel so much better on my longer runs because I just have that endurance there. Just doing the exercises feel better. That's, I think, the hard thing for people to get into strength training is because when you're not good at something, it's really frustrating.
It's really frustrating.
And it's hard to form a habit when you're frustrated with it. And so just, repeated X, getting consistent with it. At least I'm doing 2 times a week. I would really prefer 3, but 2 times a week I'm doing full body stuff, all the things I used to kind of ignore, like my hamstrings, my adductors. You'll laugh at this because I do some adductor planks, right?
I love those. Those are
excellent exercise. I used to do these and it would feel like my pelvis was going to split open. I had very weak adductors and it felt awful. And now I kind of smile when I do them, even though I still hate them. But I smile when I do it because I'm like, my pelvis feels solid.
I'm glad your pelvis feels solid.
Thank you. Yes. And it makes a difference. So I don't feel quite as tight. So I used to like do like an adductor stretch, for example, and it just felt awful. And now I don't feel quite as tight. And so just doing these little things, it's made a huge difference. And it's kind of funny because, I've been telling people to do this for a long time, but I've been joking. I'm like trying to take my own advice. And I'm really pleased to report that my advice works.
It does. Well, I'm glad to know that you're a good physical therapist since you work here.
This is all the validation you'll ever need.
I actually have been strength training 3 times a week myself, and I had a little PR the other day. I was doing hip thrusts and squatting, and I'm happy to report I'm past the 100 mark on weight for both of those things at this point, and I graduated. My weights they look like real weights. I'm really excited. But what I've noticed, everyone knows I can't really run anymore, which is total bummer, but I do exercise quite a bit. But even my walking and moving and how I treat patients feels better from the strength training. You can tell when you do strength training that you move better. And you're right, things don't hurt. Things don't really hurt as much just because you're strength training. So I didn't know we were going to get on a strength training soapbox today. But I think that if you don't do it, it should be something that you really look for and really look into. And you can do it online. You can do it if you can't do it in person. But a lot of people are now going back into the gyms with masks on. I think it's a really valuable thing, especially as you get older.
And so I toe this line a lot because I want strength training to be accessible for people. I don't want it to be intimidating or daunting or to take a ton of time. No. But I also feel that it's essential. Like, I don't want anyone running without doing some strength work.
I agree.
And, especially if they're getting back into running. A quote I really like is, you don't run to get fit, you have to get fit to run.
Absolutely.
And so I've been really enjoying working with my patients and having them do like a 6 to 8 week strength block where they're running some, they're getting back into running, ramping up their volume, but the focus really there is on strength. And so because the running volume is a little bit less, it's not as taxing on the body to do relatively challenging strength training. And I'm finding that that's working really well.
Yeah, I think that it really does work well. And if you can get somebody to recognize the importance of it, as soon as you do it, after you've been doing it 2 to 3 times a week for 4 weeks, you start to notice a difference. And when you start to notice a difference, it becomes addicting. And then your runs are faster. We know that strength training actually helps you not only stay injury-free or relatively injury-free, but it also helps you perform better. It makes you faster, more efficient, run gait looks better, everything.
Yeah, I mean, it's really like, there is no panacea, but if there was one, it would probably be strength training.
I think so.
Yeah, for sure. So what do we do about this, right? We're here saying a lot of the articles are well-intentioned, but maybe not as comprehensive as we want them to be, or we have a lot of patients who've gotten advice just to do bridges and clamshells and they'll be fine. So what do we tell patients to do? Like, what kind of message can we give our listeners today to help them feel a little bit better about what they're doing to strengthen or turn on their glutes, which isn't a term I like, but I will refrain from tearing that apart as well. What can we do to help our patients with this episode?
The first thing is dynamic warm-up. And we know that dynamic warm-up is really good for upregulation of the nervous system, for increasing blood flow, increasing heart rate, improving neuromuscular control, all of that, right? So when we say neuromuscular, it's how the nerves turn the muscles on, how the muscle talks to, or how we talk to the muscle essentially. And dynamic warm-up is really good because if you can start all of that, get that process going, then you can feel your body working. You can feel your muscles working better, and everything looks better. So whether or not you have to, quote, activate your glutes to start or not, I don't know if that's really a thing, but what I think is the truth is that if we can upregulate our nervous system, if we can turn things on a little bit before we go out, we can be more successful. And so a dynamic workout can look like many things. It can be walking lunges, it can be squats, it can be leg swings, it can be A skips, B skips, or just skipping if you don't know what an A skip or a B skip is. It can be all of those things. And just adding that for maybe 2 minutes before you go out will do the trick.
Yeah, I totally agree. I don't think I've had people come in and they're doing like 15 or 20 minute warm-up routines, which, I'm not going to say is a bad thing. I think doing exercise at any point of the day is great because those are probably exercises you need to be doing anyway. But just a few minutes to take that time to warm up. And I really want to say, too, that this doesn't matter if you're a morning runner, afternoon runner. Most likely you've been sedentary prior to this run. So you want to make sure that all systems are go. So nervous system, muscular system, getting the blood pumping. And I think that's the main thing. I don't think that there's a perfect glute activation routine out there. I do think that, especially if this is one of your problems as a runner, or if it's something you're struggling with, to feel what that feels like, whether it be sidestepping or a glute bridge or some sort of hip extension, so bringing the leg behind you to get that glute going and get that pattern going. I think that's perfectly okay, and that's actually a good idea. But I don't want people to fear going out for a run without their glutes activated.
I think that's a good point. You shouldn't be afraid of it. Just move, get the blood flowing, and do some of your exercises that you would maybe do later, do them before a run, and you should be okay. And the other thing is, let's not call it, we've mentioned it before, but let's not call it dead butt syndrome anymore. Your butt's not dead, and it's such a negative connotation. And when we're really trying to think about how can we be happy, how can we be healthy endurance athletes, how we talk to ourselves matters. And I know it's funny, but let's not say things like that have such a negative connotation. Let's just maybe think about it like, oh, okay, well, my butt's not doing exactly what I want it to do, so let's make it better.
Yeah, I want to look at this through the lens of making it stronger, not like, oh, it's so weak right now, but you can work on these things, right? They can get better.
The opportunity for growth.
Opportunity for growth.
That's right. So I get really excited when I do an evaluation, and I'm like, oh my gosh, look at this knee valgus, look at this hip drop. This is great because we can make such a big improvement.
I know, and I love showing people, a couple sessions down the road, look how much better this looks. Look at this. Yeah. And, I feel like just having that little bit of success to grasp onto really helps people. It helps get the ball rolling in terms of, keeping going, doing the little routines that maybe we don't like as much. And, seeing that success is it's the best.
It really is. I always video, do the run video, either first or second visit, and then do it again a few visits later. And after they've done their strength training or gait, whatever it is, we give them their gait cues, or they're just not hurting as much. To look at the difference in the videos is incredible. And yeah, so if you have a little hip drop and your butt's not really doing what you want it to do, don't be so negative about it. Start doing some dynamic warm-up. Definitely see somebody if you're having pain about it, and start doing some strength training. Get it firing.
Yeah, in a standing position. So, lunges, squats, single leg deadlifts. Make sure you're on your feet and you're thinking about your feet as you're doing these things too.
That's right. And don't forget your breathing. I can't believe I didn't say it earlier.
I can't either.
I know.
How dare you?
I know. Don't hold your breath. Make sure you're breathing with everything that you're doing. So I always say inhale at the top, exhale while you're doing the work. So inhale and exhale. And I cue that with every exercise I do, especially squatting, deadlifts as the weight gets heavier. Because again, remember that diaphragm pelvic floor piston is really important. So it's important for men. It's important for women. It's even more important for women that have been pregnant or postpartum or have ever had any pelvic floor issues. But that can happen with men too. So the breathing is really, really important. And that also helps with our posture. If we're breathing better, we have better posture. And if we have better running posture, our length tension and our musculature is better, we can run faster, less injury.
Look at that. Tying it together like a pro.
Wow.
Wow.
That was lucky.
It was good though. It was really good.
Thanks. All right. Well, thank you for joining us today. And of course, as usual, if you have any questions, you can shoot us an email or look for show notes. We will put some information there. And hopefully you've learned today that your butt's not dead.
Butt positivity, always.
Oh, yes. Butt positivity. I love it.
Thank you for joining us today. We're so glad you're here.
If you love this podcast, please show us some love and write us a review. We're totally serious. Write us a review and subscribe wherever you listen to your podcast. It really helps us to increase the visibility of our show and reach more endurance athletes everywhere.
And remember, that training is so much more than miles.
See you later.
See you later.